Hello, everyone. Welcome to today's webinar on the Global Cancer Health Disparities Research, the supplemental funding opportunity that I'm sure you guys have convened to hear about. We are here to share additional information with you and perhaps address if any of you have questions that you think we might clarify during this meeting, we will do so. My name is James Alaro. I'm a program director at the NCI's Center for Global Health, and I'm the PD on this funding opportunity. Again, this funding opportunity is a issuance. We issued the first supplemental funding opportunity in 2020. So this is the second time we are doing so in 2022. What I intend to do is to go through the funding opportunity itself. We'll discuss the purpose for this funding opportunity, the key elements therein that you might want to pay attention to, eligibility, budget consideration, review considerations, plus the timeline at the end. Feel free to interject with any questions as we go along. I have my colleague here, Margarita, who, for those people who might need, to ask a question perhaps in Spanish and need translation, Margarita speaks Spanish and she'll be able to help us translate. So just broadly, again, these are directly picked from the funding opportunity itself, but essentially the intent of this funding opportunity is to try to expand cancer health disparities research globally. We know, and as you guys know, that the US racial ethnic minorities or underserved populations, they continue to experience disparities in both the cancer risk and cancer outcomes. Causes of these disparities are multifactorial, including several factors like access to healthcare, diet and lifestyles, structural racism, among others. We are also aware that the US population landscape is changing, with most of the people who are making these minority populations now coming from abroad, for example, the foreign-born Hispanics, Asians, Blacks. And interestingly, most of those people are coming from LMICs. And as we are aware, the projections of cancer incidence and mortality in LMIC is really grim. So I think it's important, as we are thinking about addressing health disparities here in the US, that we think about the areas or regions where these individuals are coming from. Data is increasingly becoming clear that there are differences between the foreign-born immigrants and their counterparts here in the US. So perhaps it would be good to design some of those differences. And we thought that through this funding opportunity, we might be able to address some of that. Again, we know that health disparities is very complex. It is a global problem. And because of that, we think that we need innovative, we need multi-level type of studies, we need research collaborations across board for us to better understand the causes, the mechanisms, as well as just ways that we can resolve the problem, we can address or reduce cancer health disparities themselves. So it is important, as we see it, to expand cancer health disparities research beyond the US by including global populations. And we believe that this perhaps will help accelerate the rate at which we get to really understand our cancer health disparities. So through that, we are reissuing this call. It was really well received the first time we put it out there. We still think it is relevant. So that is what led to our decision to reissue it. Again, the purpose is to stimulate interest and promote the inclusion of global populations. Those are populations outside of the US, emphasizing populations in the LMICs to enhance and or accelerate the progress in understanding and developing interventions to reduce cancer health disparities here in the US and globally. This opportunity is designed to support NCI investigators, those who have active awards, and is designed for those people with active awards to add a global population in their research projects, thereby advancing health disparities research globally. I'll go over the research scope now. As you can see clearly stated here, really, the proposed project, as always, this is a supplemental funding opportunity, must be within the scope of the parent award. So if you have this multi-project awards, your supplement opportunity will be related to one of those projects. Just be clear to state that and to make us know which project that funding opportunity is associated with. It is usually important to consult either myself or the program director of your parent award to just make sure that whatever you're proposing is within scope. Importantly, the parent award does not need to have a cancer health disparities research, but there are two requirements that we have for this supplement. The supplement itself has to have a health disparity aspect and must also incorporate a global population. And when we talk about global population, it could be global data, maybe that is already collected. It could be global samples that you have, or it could actually be a global population, you're collecting new samples and all that. So we allow that to happen. Again, for disparities as currently defined by NCI, we encourage you to employ comparative research designs between a global population and at least one of the US racial ethnic minority populations or underserved populations like rural populations, say here in the US. I want to emphasize that that comparison is not necessarily required. It's just something we encourage, and we've previously funded people who are not necessarily doing a direct comparison. We list here several examples of the kind of work that we think might benefit from adding a global population or global data, global samples. And one change that we've added, so these others have been there before from the previous funding opportunity, but a change that we've added was that top bullet saying disparities associated with structural racism and discrimination. And this includes the impact of the chronic, excuse me, including how cumulative and chronic experiences of structural racism or discrimination really affect biology, biological processes, and or behavioral processes. As you're aware, we put some examples here. You are not limited to these examples that we are showing you there, but it's a new area of research. NCI, NIH broadly is concerned about structural racism and wants to do something to address that. So you may consider if this is your area of work. There are several other examples that we've listed here. For example, risk protective factors that differ between US and foreign populations, the influence of country of origin, length of stay, cultural beliefs, and all those others. So please go through the funding opportunity and remember, you are not limited to these examples. We encourage you to submit any science that you feel appropriate for this opportunity. Some of the key elements I just wanted to point out, again, these are supplements. They will be reviewed by program directors working at NCI. So we encourage you to be minimal with your application. So we are asking no more than 3 pages for your research strategy. It has worked well. The people who submitted before that seem to have worked. But in that, we hope that you will include, we expect that you will include the summary of the funded project itself, the parent grant that was funded, particularly maybe describing the overall objective of that project, then specifically telling us about what you're proposing on the supplement project, tying it with that parent grant to show us that connection with the parent grant, and importantly, showing us the additional value that adding that global population in your supplemental project, how that ties in and why that is important to your overall scientific goals and parent program. We expect, like we say, that you'll be adding a global population. And if you do so, we want you to explain to us Why? Justify to us why you think that is important. Maybe it is that comparative level. You're comparing maybe one population here, say the US Mexicans in Mexico and those who are in Mexico across the Texas border, for example. That would be something that would be a justification. How would you be accessing that population? This is, as you know, is only a 1-year supplement. So perhaps where relationships have already been established for new data collection might work better than when you're starting from zero. If you have data already that you have in your system, I think it's important to show us that, to just show that you're able to complete the project within the stipulated time. Again, we are Center for Global Health, so we encourage collaborations, but not just encouraging collaborations. We really want to see equitable participation by your foreign collaborators, particularly, like I said, leveraging the existing resources. Again, this is a small grant project. It's only 200,000 total budget. So if you have existing resources or partnership, I think you're probably set to do well. You're not confined to that. If you think you can do whatever you're proposing within the budget and time that we are doing so, please feel free to do so. But I think what we are emphasizing is that we want to see if in your application that if you're including the foreign collaborators, that they're playing a significant role than just riding along. I want to also emphasize that the studies may involve the collection and or analysis of samples and or data from previous studies. We've seen in the previous application where people actually used what they had already collected, and that was okay. Where appropriately justified, we will also support an opportunity for you to collect new data. There are examples where people used this opportunity to actually increase their sample sizes for the kind of studies that they were doing. So it is important for you, if you do so, to justify why it is that you're doing so. An important aspect that we've added this time is the idea that we expect the PI to submit the final progress reports for this supplemental award to me, to the program director listed on that NOSI. As you realize, your project sometimes, your parent award might be long. Eventually, you will include this into the final progress report of your project. But for us to have an easy access to that, whatever, and specifically because your supplement may end sooner before your final project reports for your parent award are due, it will be important for you to send them to us. Eligibility considerations, again, we've listed the activity codes that are supported here. The parent has to be an NCI supported award that is active, and where the parent includes multiple PDs or PIs. Again, we request that the way you request this, we request that any or all of the PDs could be listed according to the leadership plan that you had previously, and that the supplement be submitted by the awardee institution of the parent award itself. I've said that this is a reissuance, so we expect that there may be some people who were awarded in the previous round. They are eligible to apply again, but only if they've issued their final progress reports to us. So if you've not finished that previous award, or if you've not finished the progress report by the time you're submitting the new award, then you will not be eligible. As we say, we expect you to add a global population data or samples, and sometimes when you're adding a global population and you didn't have a foreign component in the parent award, it would be important for you to add a foreign component. This question came quite a bit in the last issuance, so we decided to address it. We want to remind you that as a parent award, you're allowed to add a foreign component, but you need or you require for NCI to issue you with a prior approval. So what that means is that if you intend to add a foreign component onto your parent award, please reach out to the GMO that is listed on the notice of award. You can CC me on that email, but reach out to the GMO. This is a formal process. You need to write up to them, or you need to write to the person and let them know that you intend to add a foreign component. They will issue you with an approval to do so. So by the time you're submitting your application, this should be in order. I think it requires you to do so pretty soon. This, I think it's 30 days, so you may want to think about that. This would be a situation, for example, if it is a US institution, say you are working in Uganda, but now for this supplement, you want to include a population that is in Vietnam, for example. That would be an additional foreign component, and therefore you might want to ask for prior approval before you submit your application. The budget remains the same as it was in the previous award, $200,000 US in total costs. That includes both the directs and indirects. Again, we limit the budget to 1 year period, and so is the project period limited to that 1 year. As I mentioned before, the project and the budget periods must be within the currently approved project period for the existing parent award. You cannot request an extension to the parent award for the purposes of applying for a supplement. Only one supplement will be funded per grant. So we ask you to consider that when you're submitting your application. The review criteria again remains the same. We'll look at whether your proposed project is within the scope of the parent award. So that is why I said it's important for you to talk to your PD if you have any doubt, and whether it is a logical extension of the regional aims that were proposed. We'll ask whether the administrative supplement reasonably allows for the project to be completed within time and within budget. We will seek to see whether the proposed project identifies an important scientific gap that advances disparities of research. We will seek to see whether your project include and appropriately justifies the inclusion of the global population, biospecimens, and or data. And we will also check whether you have reasonable access to that population. What that means, for example, if you propose to collect new samples and we don't see that you are able to do so, then that may make your grant difficult to fund. Or if you're asking to ship in samples from another region that has a lot of, or a country that has a lot of problems with samples going out, that might delay your project for another 7 months or so, then that might also raise questions around whether you will be able to finish the project in time. I put here generally the timeline. So the applications for this grant are due on May 24th. We expect that we will do the administrative review. Again, this will be internal by NCI program directors between July or August of this year. And hopefully we get them funded by end of September. Again, like I said, the project period is 1 year. So that is just quickly running through what the supplemental funding opportunity was. I expect that if there are any questions that are coming from you, that we may be able to address them directly. So I guess I'll open the floor for everyone. I'll stop sharing so that I can see hands. Denise.
Hi, thank you for your talk. And I'm really worried about the period of the project because I'm an ecologist in Peru, and actually we do some research, retrospective and prospective research in our group, which is a lymphoma group. It's like we have 14 countries around Latin America, so the majority of our projects is around, we do the follow-up with a minimum of 2 years. So I was really worried about the period is that it's like 1 year, only 1 year. So we cannot do any extension to do the follow-up with a minimum of 2 years?
So just administratively, the supplement awards by NCI are for 1 year. So the funds then have to be spent within that 1 year, right? So in very rare occasions, few occasions, like what happened with the impact of COVID, there are PIs that requested for a no-cost extension, and that no-cost extension was no more than 6 months. So I think if you're planning to do something, you should plan to do it within the 1 year, or you should plan a scope that you can complete within the 1 year. 2 years, I think, would be stretching it. And as written, as the funding opportunity is written now, is a 1 year. So if you come in with an application that states 2 years, you can see how that probably might not work well for the review.
Okay.
Does that address? Partially
Yes.
address your problem?
Yeah. Yeah. Yes. And we have a month to submit the proposal, right? The clinical research question and so on. It's like a summary, and the clinical research question you have to submit in 1 month. And there is a format, or like a format to do it, or is there any
Yes. So if I get your question, so I think if you are not the PI of the NCI funded award, I would encourage you to talk to the PI because they will know how the process of submitting an application goes and what particular forms need to be filled when. Yes, sure. And so your institution, one of those institutions that has that award. So if you reach out to that parent or the PI on the parent award, they'll be able to know the process already. And there's a tedious process, as you're aware, and we've described that on the funding opportunity, but they'll be able to guide you through that.
All right. So I will get like a mentor to maybe to instruct me how to submit these forms, and because I don't have enough time to do it, and I want to submit because I have a good clinical research proposal, but I don't know if I have enough time to submit all forms in 1 month. So.
Let me ask you, maybe I'm not following, and Margarita, perhaps you can help here. So my question is, so the applicant, the person who submits the application, needs to already have an NCI funded grant. Right. So then if you are going to work on that grant, if you are not the PI yourself, then you need to be working with the PI of the parent award to submit a project that then maybe you will be participating in as the person doing the actual project. But because this is a supplement, you cannot just submit the application yourself if you're not the PI of the parent award. Do you have an existing NCI award at this point?
No.
Yes, so then, yeah, it's okay. So then I get it. So then you will need to get, if one of the groups that you're working with, the person who is leading the NCI funded award, okay, I would encourage you to reach out to them with your interest, because you're already in the group, and alert them to this opportunity if they don't know. And I assure you that if you show them the opportunity and they have interest in the project that you're saying, they will know to submit and to work to submit within a month. But again, we've had this opportunity out now for, this is the 2nd month. It's just we are having the webinar today, but we've had it for some time out there now. Okay. I see hands from, is that okay, Denise?
Yes, sure, thank you.
Okay, thanks. Louise?
Yes, thank you, Dr. Alharo. Can you hear me well?
Yes.
Yeah, so I actually work with Denise. The thing is, I didn't give her the details and I just sent the email. We do have an NCI NIH grant. She's from Peru. She'll be collaborating with us, but I guess her question were directed about it. but I just wanted her to attend to this, so that way I can follow with her after that of what consists the supplemental part. But I guess didn't do it. But my question for you is, so in regards to the collaborator, I guess if I understand well, once we present the LOI, the collaborator can be overseas, so that way they can conduct the part of the research we're proposing in the collaboration. I guess there is no restrictions about citizenship or anything else for the collaborators in the case of the supplementals, if they're going to be based in a different country. And I guess the last question I have, following what Denise said, just as an idea of a proposal, if, for example, our research is conducting about a particular type of cancer that is considered rare in the US, but perhaps prevalent or in other countries, can that be something that could be of interest? Because that's one of the challenges we have, for example, in certain hematologic cancers, are that many of the viral mediated lymphomas are not really based or very rare in the US, but are extremely common in Latin America. So that's basically are my few questions.
No, so I'll start with the last one. So it's correct. And I think we state that specifically as looking at those rare cancers that are common elsewhere, but not in the US, in which case that then there's no requirement for you to do a comparative kind of study, right? That is why I said that we encourage comparative, but it is not required. So in your case, you'll be looking at a rare cancer elsewhere. So that will be allowable. And your first question escapes my mind. Can you repeat for me your first question?
So the first question is mainly that I'm based in the United States and I'm part of the NCI project we have.
I come back. So you are asking where, so two things. If you have a collaborator from LMIC that we encourage you to have a collaborator. If you like you're saying, if you're working in another country, we are encouraging you to have a collaborator from that country where you actually conduct the research. If you are say you are collecting samples in Peru, for example, then it means that the research will be done in Peru, right? But if you already had existing samples and you decide to say, okay, I'm bringing Denise to my lab in the US to analyze those samples here in the US, again, we allow that. So we don't necessarily require that everything be done or the research be done in LMIC. We're just saying that when you bring a collaborator on, like you are intending to do in this case, that you show that that collaborator is involved in a substantial way. And therefore, it doesn't matter where they are. If your research requires them to be in Peru, yeah, so they will be in Peru doing that work. If, for example, your research requires them to come and do some data analysis or run their samples in your lab and things like that, that is also okay. Does that address your question?
Yeah, I did. Thank you very much.
Yeah, I see Valerie.
Hi, James. Thanks for the talk. It's a nice opportunity. Just to check, would this supplement be suitable for like introducing an intervention that might reduce disparities in cancer outcomes? Or is it purely etiological epidemiology?
No, interventions are allowed, or maybe not, again, small money. So it's, maybe you are thinking about testing an intervention and some early aspects of that intervention that can be done within the budget, within the year.
Yeah, yes, pilot and feasibility, yeah.
Yes, for example, I think the last bullet actually specifically says, for example, if you're looking at screening and maybe new interventions or why existing interventions are not working and therefore aiming to improve them, that would be allowed. And sometimes it might just be maybe an implementation and dissemination science type project, like you seem to be proposing, that will be allowed in this case. So we are not limiting the research. All the requirement is here is that if you are doing so, then it has to bring on that disparities component and include a global population. So those are the two requirements for this supplement. And the science that you do then is very broad.
Okay, perfect. Thanks a lot.
And limited by the scope of your parent award. So yeah. It's broad and limited.
Thanks.
Will?
Yeah, thank you very much, James. My question is more about, so if we submit this on May 24th or so, how long is it going to take to get a decision? And when is the funding, what will be the funding start date?
Yeah, the funding start date we intend to fund the projects within this, with the funds marked for this fiscal year, and our fiscal year ends on September 30th. So that will be the latest that we can issue the award. So we expect starting dates for your funds to be, say, October 1st, for example. But the money shall have gone out by September 30th. These are earmarked for this year's FY22 funds. We, like I showed in the timeline there, we expect to do the reviews sometime in July, maybe July, August time period. And you should be hearing from us in September for sure, early September. And the funding should be done by the end of September.
All right, thank you so much. Yeah.
Mm-hmm. Any additional questions? Again, we are available for questions. I know usually we wait until the end for you guys to start writing. We are available. If you have any questions that you want us to clarify, please reach out. I've attached my email address, and we will also post this recording on our website, CGH website. So if somebody wants to access this later, do so. But yeah, for sure, reach out to us. I think reach out to your parent PD, or just reach out to me if you want to kind of just talk about what you're thinking and making sure that it is within the scope of what CGH is interested in broadly. Please feel free to do so. We can always set time with you.
Thank you very much.
Thank you. Will, go ahead.
Thank you very much. That was very informative.
Yeah.
Thank you.
Thank you all. Thank you all for attending, and good luck.
Good luck.
Okay, bye.
Thank you. Thank you, bye.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov/global health, 1-800-4-CANCER. Produced March 2022.